page. What brings you in today?
I was in a car accident a year ago, and now I have really bad pain in my upper neck and back into my shoulder when I'm moving to the left.
Okay, and when did your pain begin? Like the pain that's been bothering you the most recently?
My neck has been over the last week, but it gradually started right after the accident a year ago.
Okay, so gradually right after the accident, and then a little over about a week ago. And then what other things provoke your pain? Like what makes it worse, would you say?
Looking down, putting my hair up,
Okay.
bending down, and sleeping.
Okay, so even sleeping, okay. And how could you describe your pain? Like if you could give it like a feeling, like a sensation.
Like sharp.
Okay, so
Yeah,
sharp pain. And that's when you're turning your head?
Yeah, when I'm turning or moving my left arm.
Okay, and do you have pain that moves? Does it go down your arm at all?
Yes, it goes all the way down my arm.
Okay, down your arm, into your hand and everything. How can you describe that? Is it like numbness and tingling, or is it like shooting pain?
It's numbness down my whole arm and like pins and needles in my hands and fingertips.
Okay, so pins and needles. Okay, and then on a scale of 1 to 10, 10 being the worst pain you've ever felt, what would you rate it at its worst?
9.
A 9? Okay, what are you usually doing when it's like a 9?
Like a lot of times working when I'm looking down or driving.
Okay, so working, driving. All right, and then for work, you said that you work in a pharmacy. So what are you usually doing like in the pharmacy that makes it worse?
Filling prescriptions, so I'm looking down, counting the pills the whole time. Or it's just a lot of running around, so I'm moving it to each side a lot.
Yeah, okay. And then when it's at its best, what would you rate your pain out of 10?
Like a 4.
Like a 4? And then what are you usually doing when it's at its best?
Usually just sitting in bed. I have to be sitting like straight up.
Straight up. And you said before, you mentioned that you elevate your arm too, and sometimes that helps?
Yeah, when I'm laying down on my back, I elevate my left arm. The numbness isn't there and it doesn't really hurt my shoulder anymore.
Okay. And then what would you rate it right now while we're sitting here?
Like a 6, 7.
6 or 7. Okay. And then time of day, you said when you get up in the morning, what other times, like at work?
When I like finally sit down to relax, when I'm not moving it and I'm just looking straight, like at the end of the day, it starts to like throb.
Okay. And then are there any other things that you're unable to do that we haven't mentioned?
Not really. That's about it. Just like moving my arm up, looking down.
Okay, understood. So I just want to recap real quick that it's your left arm and suspicious of cervical radiculopathy, which is, we'll explain that in a little bit. And then activity would be looking down and like working at the pharmacy and like looking, filling pills, and participation would be, going to work and doing other things like that. So I just want to check your rotation real quick. Would you be able to look as far as you can to the left? And then to the other way. Okay, I just want to do a test really quick. This one's called a shock pressor. Is it okay if I put my hands on you?
Yes.
Okay, great. I'm just gonna put my hands here. And can you look down at the tile in front of you there? I'm just gonna put my arm around your head and pull back. Please let me know if there's anything that's uncomfortable at all.
Kind of right there.
Right there a little bit. Okay, so we held there. Everything seems fine there. And I'm just gonna do one more quick test where I put my hand on the top of your head and one back here. I just wanna feel something real quick. Just here, good. Good. Everything looks good there. Is it okay if we take a few vitals today? All right, so you can relax your hand right here. Just feel for a pulse. Cool. So for your heart rate, I got 82 beats per minute, and for your respiratory rate, I got 20 respirations per minute. I just need to take a blood pressure, if that's okay with you. Okay, so I got 150 over 110.
We're gonna do a quick observation. I'm just gonna check the curves of your spine, look at rounded shoulders, look at all angles. Just look at the height of the shoulders. I'm seeing some forward head. One more angle. Back, the height of the scapulas. Okay. And now can you take a seat, please? We're gonna go into a palpation screen. Is it okay if I put my hands on your wrist? Awesome. And it's your left side, correct?
Yes.
Awesome. So come over here. I'm gonna start with my warmth and edema. Alright, everything seems good. And now I'm gonna locate some structures. I'm gonna be looking for hypertonicity, reactivity. If you feel any pain on anything, just let me know, okay? I'm gonna start with the mastoid process. Work my way down to her SCMs. Again, if you have any pain or anything, please let me know. Work my way back to the transverse processes, making sure they're in alignment. I can come down into levator and then upper trap. Is there any tenderness here or anything? Any pain?
Tender.
Tender. Okay, I'm gonna come back, go to the pillars on each side, making sure they're in alignment. Any tenderness here?
A tiny bit.
On the pillars, okay. On which side? This side?
The left.
Yeah, always on the left. Okay, I'm gonna work my way to the spinous processes. Any tenderness here?
Oh no. It's like flutter top.
On this one?
A tiny bit? Yeah.
Tiny bit?
Yeah.
That's my C5, 6. Okay, now we're gonna go down to your thoracic region. Keep working my way down. If there's any tenderness or pain here, please let me know.
Definitely right there.
Definitely right here. Okay. These are the spinous processes. I'm gonna work my way onto the TPs. Any tenderness here?
Yeah, somewhat.
Tenderness here. In the rhomboid area. Tenderness. Okay. Now I'm gonna make sure your scaps are in alignment here. The spine should align with your T3. Okay, it does. The inferior angle should be aligned with T7. Okay, now I'm gonna finish with my myofascial. Other side. Okay. So we're gonna assess gross movement first. So what I want you to do, we're gonna start with your right arm first. I want to give yourself a hug. Do you have any pain with this or anything? And now we're gonna reach overhead as much as we can on that right arm. Do you have any pain with this?
You know, on my left side.
A little bit of pain on the left side. Okay, now we're gonna do one more on that right arm. Reach up as much as you can. Any pain or discomfort here? Okay, and now we're gonna do the same process on the left. Give yourself a hug. Pain or discomfort? Okay, reach up overhead.
No.
No pain on this side. And then that last one, reach back. Anything here, pain or discomfort? Okay, awesome. All right, we're gonna do a range of motion STTT test. So what we're gonna do first, I'm gonna show you, I want you to do a slight chin nod, and then I'm just gonna apply some pressure, okay? Slight chin nod. Do you have any pain here?
No.
Okay. And now I want you to go into full flexion, bring that down. Do you have any pain with this?
Discomfort.
Discomfort? Okay, now we're gonna back off a little bit, relax, don't let me move you. Any pain there?
No.
Okay. And now what we're gonna do, I want you to look at two tiles or a tile on the ceiling. Okay. Any pain here? Okay. And now I want you to extend that neck back as much as you can. Any pain there? Okay, you have pain there. And now I want you to side bend to one side, you can pick. Okay, any pain there?
Yes.
Okay. Any pain here?
Yeah.
Okay, now we're gonna back off, relax, don't let me move you. Any pain here?
Yeah.
Okay. Now can you side bend to this side? Any pain there?
Discomfort.
Discomfort? Any pain there?
Not really.
Okay, now relax, we're gonna back off a little bit. Don't let me move you. Any pain there?
No.
No? Okay, and now you can rotate to one side for me, just your head. Any pain there?
No.
Any pain here?
No.
Okay, now we're gonna relax, back off a little bit. Don't let me move you. Pain there?
No.
Okay, rotate to the other side for me. Any pain here?
Yeah.
Okay. Any pain there? Okay, now we're gonna relax, back off a little bit. Don't let me move you. Pain here?
Yeah.
Okay. And now we're gonna stay seated for the next one. I want you to just flex your trunk forward and keep my hand here. Any pain there?
No.
Okay, now flex back over my hand, extend back. Pain here?
No.
Okay. And now we're going to side bend this side for me, over my hand. Any pain there?
A little bit on my left.
A little bit on your left, okay. Now side bend to this side for me. Pain there?
Yeah.
Okay. Now we're gonna come back to neutral. Can you rotate to one side for me? Pain here? Okay. Can you rotate to the other side? Pain there?
Yeah.
Okay.
Okay, Paige, so the next thing we're gonna do is just some quick strength testing, okay? So I'm just gonna put my hands on you and just resist a little bit, and you just let me know if anything bothers you, okay? Alright, so I'm just gonna stay hand on your forehead real quick. Alright, Joel, let me move you. Any pain or discomfort there?
Yeah, pain.
Okay, we're in that same spot in the back? Like that left side?
Yeah, on the left.
Okay. Alright, Joel, let me move you. I'm gonna push forward. Any pain with that?
No.
Okay. Push to the side, don't let me move you. Any pain there?
Yeah, on the left side.
On the left side, alright. On the right, don't let me move you. Any pain there?
No.
Okay. Twist, don't let me move you. Any pain with that? No. On the right, don't let me move you. Pain there?
A little bit on the left.
On the side, okay. Alright, so put my hand on your chest. Don't let me push you back. Any pain there?
Not really, no.
Okay. Alright. Don't let me move you forward. Any pain with that?
A little bit right on the back of my neck.
Okay. Where my hand was or into the neck?
Up in.
Gotcha.
There.
Alright, so I'm gonna twist. Don't let me move you. Here, lock in. Don't let me move you. Any pain there? Okay. Other way. Don't let me move you. Any pain there? Okay. Perfect. I'm gonna come around the shoulders. Don't let me push your shoulders down. Any pain there? Okay. Don't let me push your shoulders up. Any pain there?
No.
Okay. Don't let me push the shoulder back. Pain there? Push it forward. Don't let me move you. Pain there?
A little on the left.
On the left. Okay. Same thing on the other side. Don't let me pull your shoulder back. Any pain?
No.
Don't let me pull you forward. Any pain?
In the left.
Okay. In the back?
In the, yeah, in the
Up in the
back.
neck? Alright, gotcha. Okay, last thing. Don't let me move you. I'm gonna push down. Any pain there?
Yeah, in my left.
On the left side. Alright. On the right, don't let me move you. Any pain there?
No.
Okay. Okay, Paige. Next thing we're going to check is just some of your neuro symptoms and some of the sensory in your neck and your arms, okay? So I'm going to use this little brush. It's just going to give like a little sensation. Do you feel that? Okay, so what I'm going to have you do is I'm going to have you close your eyes and I'm just going to pinpoint some spots and you just let me know if you feel it, okay? Alright, so close your eyes. You just let me know if you feel it, okay? Yeah. Gotcha. So keep your eyes closed. Oh, perfect. You can open your eyes. Alright, so far everything looks good there. There doesn't seem to be any sensory issues. So next thing we're going to do is just kind of test how the nerve and muscle work together, right? So first thing I want you to do is shrug up your shoulders for me. Hold that there. Don't let me move. And just say here, right there. So this side out. Head about. And then head low. In there. Okay, and pull them out. Next thing I want to do is I just want to check some reflexes. So I'm going to start on the right side just since that side's not bothering us too much. So what I'm going to have you do is I'm going to have you relax, kind of look away. And I just want to see how things react, okay? Okay, alright, so reflexes look really good. I don't see any issues there. First thing I'm going to do right behind you is I'm just going to have you sit in a neutral position. I'm just going to apply a little pressure through the top of your head. You let me know if that reproduces the symptoms, okay?
Yes.
Okay. Alright, so relax there. Put my hands kind of right under here and I'm going to apply a little bit of a distraction. Does that make the symptoms go away?
Yeah.
Perfect. Very nice. So that is a positive Sperling's and a positive distraction test. Next thing I want is I want you to lay down on your back on the table.
Do you want me to do this?
It's up to you. You don't have to. Okay, I'm gonna have you, actually gonna do on the right side first, just to kind of see how things are feeling. I'm gonna have you scoot a tiny bit closer to me. There we go. You let this arm kind of be loosey-goosey. Is this okay here? Okay, let me know if anything starts to bother you, okay? Back off a little bit. A little tight there. Does that feel okay? Nice. Any of those symptoms? Okay, perfect. I'm gonna let you relax with this arm. Scoot a little bit closer to the other side for me. I'm gonna do the same thing over here. Okay, just let me know if anything starts to bother you, okay?
A little bit there.
Okay. That same symptom or tightness, what are you feeling?
Tightness.
Okay. I'll relax a little bit. Any of that numbness or tingling?
Yeah.
Okay. And that is a positive upper limb tension test A.
So we're just going to take a look at your left rotation, just because that seemed to be the most limited in our earlier screens. So what I'm going to be looking for this time when you do it is just any sort of gives, compensations, or deviations you may have. Whether you start with a chin poke, there's some side bending or rotational gives, so like those are cardinal plane gives, frontal, sagittal, and transverse plane. I'd also look for any sort of segmental gives, which I'd be able to feel, like any sort of anterior translation that's going on in the neck. So could I just see you turn your head to the left? Okay. And then we could also see the segmental gives through some of the skin folds that go on when you turn your neck. But now I'm just going to apply biomechanical correction. So I'm just going to be trying to put the bone in kind of an optimal position for your rotation. And I'm going to work my way from the top of your cervical spine to kind of like your upper thoracic spine here. So you can turn to the left. Maybe turn. Okay, turn to the left. You can turn to the left. Okay. And one more time, turn to the left. Okay. And over here, and turn to the left. Good. Alright, and now I'm just going to move down, so I'm just going to change the grip a little bit. Awesome. So, continue to the left. Okay. And you can turn to the left. Okay. And let's just do one more here, and turn to the left. So, what we were looking for there for our comparable signs, well, it was mostly just your range of motion, and there was a little bit of a side bend give. So when we applied the biomechanical corrections, it seemed to be most beneficial at your C6, C7 segment. So we got the most improvement in range of motion and got rid of that side bend give. So we would kind of look to apply our further breakouts and treatments to that section specifically.
Okay, so is it okay if I take a quick range of motion measurement? Okay. So all I'm gonna have you do is, when you're ready, you can just turn your head to the left. Okay, so you're about 45 degrees. So now I'm gonna move, is it okay if I move you a little bit more to see if I can get some more? All right. So now I'm just gonna move you. You let me know if you have any pain. Right there, okay. So I'm just gonna hold that. And get a little bit more, get about 52 degrees, so a little bit more passively. And then while we're here, I'm just gonna try something else. So I'm just gonna lift up the shoulder, and you can relax that arm, and then same thing, you're just gonna rotate to the left. Okay, how does that feel? Good. A little bit. Now I'm gonna bring this down a bit more, and then try it again. How does that feel? A little limited. Okay, so I'm gonna do the same thing on this side. Just gonna lift it, relax. Then go ahead. Good. How does that feel? Good. I feel like I can go a little bit farther. So I'm gonna bring this down and then try that again. Limited. Okay. So, and then while we're here, I'm just gonna take this hand, shoot up here, and then you just let me know if you have any of those nerve symptoms down your arm, okay? Yeah, so if you can turn your head to the left. Perfect. And then down your right there, okay. So because that test before brought on some of your numbness, tingling, nerve symptoms, I'm gonna run some more tests to kind of figure out maybe which nerve is bothering you, okay? So once again, once you feel those symptoms, you just let me know any discomfort and I'll back off, okay? All right, so the first one, I'm gonna take your hand and this way. I'm gonna have you side bend a little bit away. Yep. Good so far. And a little bit there. All right, so I'm gonna back off a little bit, and then I'm gonna try a different one. Can you just scooch a little bit closer to me? Yep. And then on the same thing, I'll have you side bend away. And I'm just gonna take your hand. I'm gonna have you bend your fingers for me, like down. Yep. Press this, and then same thing. Any symptoms, you let me know. So good. Tiny bit right there. All right. So now I just want to take a look at your strength. So if you can rotate to the left for me a little bit. Perfect. Do you have any pain here? Not really. All right. So now I'm gonna apply pressure. Don't let me move you. Okay. So ready? Push, push, push. Okay. So now I'm gonna have you lay on your back for me. And then same thing. You're gonna rotate to the left. And then I want you to try and lift your head up for me if you can. You have pain here? All right, so you can relax. I would give you a 3- mmHg grade for that because you can lift up and then pain out of it, okay? So now I want to do a test, and it's going to target your strength, your endurance, and kind of the way your muscles work together. So the idea, the goal of it all is that we get the deep muscles in the front of your neck to kind of turn on, so you have stability, you have support, and that your bigger muscles don't turn on because that's what causes a lot of our pain. So what I'm going to show you is you have this blood pressure cuff under your neck already. You're going to hold this in your eyesight so you can see that. I'm going to pump it up to the 20 line, and then when I say go, you're just going to push into it a little bit up until that next little mark. I want you to try and hold it for 10 seconds, but if it feels to get to be too challenging before then, or pain, you just stop whatever and restart. All right, so do you have any questions about that? Okay. So I'm going to pump it up to 20. Alright, so when you're ready, press into it a little bit. Perfect, and try and hold it there. Okay, so it's okay. So we held it for about 5 seconds, so let's try and go again. Okay, relax. So it seems like you're holding it for about 5 seconds before it kind of goes down. So let's try and do about 8 or 9 more times of 5 seconds holding it there and then coming down. Good. I go back and forth, like can't hold it good. Okay. Let's do this more times. Alright, do you have any questions about that? Do you feel like it's trying to engage your certain muscles?
Yeah.
Good. Alright, okay. Alright, Paige, so because you've been having some pain in your neck and it seems like some of those bigger muscles are a bit tight and it was restricting your range of motion, I'm going to put you into, it should feel like kind of a stretch. I'm just kind of assessing like the length of the muscles and trying to compare to both sides just to get a sense of what that looks like in your neck, okay? And same thing as always, if you have any pain or the numbness and tingling, you just let me know. But all I want you to do is just relax there. I'm going to do all the work. All right, so I'm just going to bring your head up. I'm just making sure you relax. We're good so far? All right, so I'm going to bring you to the side. Still good? Rotate this way. Same thing, I want you to relax. You're good. And how are you so far? Good. Good. Right, just press a little bit. Good. Right, so I'm going to get back. Relax. Good. Still good? Other side. Make sure you relax. Good. Alright. Now do the next one. So bring it up again. Relax. This side. Still good? Rotate this way. second, okay? I'm gonna push my hair. Get that in. Relax. How's that?
Alright, Paige, so through our evaluation, what we found is that you have a possible PA of cervical radiculopathy, which is we found because of the positive distraction test we did earlier, compression test, and upper limb tension test, with a PM of a hypomobility, a C6, C7. So those vertebrae just aren't moving as much as they need to be when you do your rotation. And that we got because the correction that I applied when I moved those segments helped you rotate more and then eliminated the side bend give that you had with rotation. And then we think this is driven from some of those deep neck flexors not activating properly, maybe due to some postural things with the forward head posture, as well as that causes some of those superficial muscles to turn on, which is why we have some tightness in the back there.
Alright, so due to your pathoanatomical diagnosis of cervical radiculopathy, I'm going to perform what's called a distraction in your neck, which will help alleviate those symptoms of the numbness and tingling going down your left side. So is it okay if I just put my hands on you? And yep. Alright, so I'm going to come here, and then just relax into my hand. Pronate my hand. Sorry, pronate my hand. So then I would hold it for a few seconds. And cast it on the patient. Yes, I'm doing that just 100 to know. Push it. Are you comfortable or? Yes, yes. Alright, so I'm gonna release it now. And then just kind of let me know how that feels. If you want, you can sit up and then kind of move your neck around and see how that feels too. Feels good? Nice. Alright, so the next technique I'm going to do is going to help you get more left rotation in your neck. So basically I'm going to put my hands around your neck like this, and I'm going to be pushing the spinous process of your vertebrae to the right to help you get more left rotation. Alright, so if anything is too painful or anything, just let me know and I will put less pressure or we can stop, alright? So I'm going to be pushing her C6 spinous process to the right, and I'm inducing left rotation in her cervical, and I'm doing a grade 3 to get more range of motion in her left rotation.
A little painful there.
A little painful, so I'll just put some less pressure. So because she's feeling pain, I had to move to grade 2 to assist more pain. And I'm doing fast osculations. And I would be doing this for about 30 seconds, 10 times. So I'm like yours. Feel okay? Alright, so I'm doing this again. Doing a grade 2 for pain. Alright, so during our biofeedback, when we did the blood pressure behind your head, we found that you have poor endurance in your neck, deep neck flexors, which is okay, we're gonna work on that. So what I want you to do, so this is your STM, also known as your sternocleidomastoid. They want to turn on when you lift your head, which we don't want that. So I want you to try to relax this part right here, and I want you to use this part of your neck more. So when you try to do a little nod with your head, and just try your best to relax this part and use this part over here. So try that for me. Yeah, that looks pretty good. So for now, you don't have to maintain it. For the next part, I want you to do that little chin tuck, the little chin nod again, and I want you to lift your head I'll tell you when to stop, but it's going to be about 1 inch off of the table, and I want you to maintain that as best as you can, alright? Alright, when you're ready, do that little chin tuck, and then lift your head, and right there. So right now I'm timing it. You can relax. That was about 5 seconds. So we're going to do that one more time. I just want to see if you're able to maintain it. So go when you're ready. I want you to do that little chin nod, and then lift your head. Yep. Just about there. A little lower, actually. About there. Yeah. All right. So what I'm gonna switch to, I'm gonna help bring your head up, and I want you to slowly lower it down. This is just gonna be where we're gonna start with this, just due to, like I said, mentioned before, you have a little weakness in the endurance side of your local muscles for neck flexing your neck. So I'm gonna make it a little easier for you. So I'm gonna lift your head. So I'm not gonna do it just yet. I'm gonna lift your head, and I want you to slowly lower it down. All right? All right. So do that little chin nod, and then I'm gonna lift your head, and then I'm gonna let go, and you're slowly lower it down. So a little slower than that. It's okay. Don't worry. So we're gonna do that again. So do that little chin nod again. Relax. Okay, do that little chin nod. That was better. And then I'm gonna lift you up. A little slow. Yeah, just like that. Feels okay?
Mm-hmm.
So we're gonna do that about. I'm gonna lift your head up, and then you're gonna slowly lower that, and we're gonna do that like 8 times, 3 sets. All right? Now let's do that. So lower your head. I do that little chin nod. I'm gonna lift your head and slowly lower it down. Nice, that was a good one. And then do that little chin nod. Lift your head. Slowly bring it down. Nice. Let's do one more. So we're gonna do that one more time. So go ahead and do that little. Okay, go ahead and do that chin nod. Lift your head. Yes, just like that. That looked really good. All right.
For the motor learning intervention section, we demonstrated slow, controlled left cervical rotation twice while keeping her shoulders relaxed. We provided her with the cue, nose to your shoulder. For the regression, first, we changed the external focus cue and provided a red dot on the wall and said, turn your nose to the red dot. We utilized concurrent feedback by saying, target, repeatedly while she was doing the motion. For overlearning and mental practice, once she achieved the desired slow and controlled motion, we had her repeat the motion 4 times, since it took her 4 times to achieve the task. We incorporated variability by saying right and left, and also had her mentally rehearse the task. Progression, once she practiced overlearning, we started progressing the task. We removed all previous regressions, cues, and concurrent feedback, had her doing it standing and sitting on an unstable surface, and asked her math questions to induce a cognitive load.
So now that we tried to work on some interventions, I'm just gonna see how you rotate again. So I'm gonna be looking for the same if we got improved range of motion and if we got rid of the side bend give when you rotate your head to the left now, okay? So you can move to the left for me.
The first one we're going to do is a levator scap stretch, which first you're going to flex your head, you're going to side bend to the right, you're going to rotate to the right like you're looking at your armpit, and then you're going to take your right arm, put it on the back of your head, and pull down into a stretch. You should feel a stretch on the left side there. Good, and then we're going to do that for 30 seconds, 3 times, and that's something you could do at home as well. It's called a snag, so I'm going to sit next to you while we do this. So you're going to take this, and you're going to put it around the back of your neck here, and you're going to cross your arms over, take the top one, pull it across, and then the bottom one is also going to pull across here. And you should just feel like a pull happening in the back. If you want to give that a try, we'll do that one for 10 seconds, 10 times. So bring it around the back there, and then cross, put this on here. So there, and then under, go there, and then this one. Okay, you're good. And then pull, and then also rotate to the left. Good. Cool. So again, like I said, 10 seconds, 10 times. And then you can also do that one at home as well. Cool. Great. What we're gonna do is chin tucks. So remember the blood pressure cuff one we did before? It's gonna be like that, but you can put a towel behind your head and you can just press into that kind of, and then you should just be feeling these neck flexors, the deep ones firing, which like you kind of will feel like a burn in the back of your throat a little bit. Yeah, so you can do that one also 10 seconds, 10 times.
So for the patient goals, the short-term goals will be based on a 3-week time period. Patient will be able to perform the craniocervical flexion test to 24 millimeters of mercury, 10 times 10-second holds without pain, demonstrating measurable improvement of deep neck flexor endurance in order to enhance cervical spine stability during daily activities and reduce symptom reoccurrence. Patient will also be able to increase left cervical flexion from 45 degrees active range of motion to 60 degrees active range of motion at a 3 out of 10 or less on the VAS scale in order to perform ADLs such as driving to work. Patient will report a decrease in pain with activity from 9 out of 10 to 6 out of 10 in order to work in a standing position for 20 minutes before the onset of symptoms. And then the patient long-term goals will be based on a 7-week time period. Patient will be able to demonstrate through self-report the ability to stand for 1 hour with neck pain less than or equal to a 3 out of 10 on the VAS scale and no numbness or tingling in order to stand for work as a pharmacy technician. Patient will be able to perform the craniocervical flexion test to 26 millimeters of mercury 10 times with 10-second holds without pain, demonstrating measurable improvement of deep neck flexor endurance in order to enhance cervical spine stability during daily activities and reduce symptom reoccurrence. And patient will be able to increase left cervical rotation active range of motion from 45 degrees to 70 degrees active range of motion, pain-free in order to complete ADLs such as driving to work.
Due to our patient's pathomechanical diagnosis of cervical hypomobility at the C6-C7 region, our group was led to the direction of prescribing cervical snags and her HEP. In this study, 47 patients, 24 males and 23 females, were separated into 2 groups, 1 snags and 1 being mechanical cervical traction for 25 minutes twice a week for 6 weeks. After 6 weeks, the difference in the snag group and the mechanical cervical traction group were statistically significant in terms of pain intensity and neck disability. The research concluded mechanical cervical traction reduced disability and increased range of motion better, but snags reduced pain intensity more. While our group is looking for a range of motion increase in our goals, our primary concern is our patient's comfortability. Her pain only gets down to 4 out of 10, and we believe we can provide these interventions to reduce that score even more and eventually transfer this into her work to get her back into a primary level of care. During our evaluation and treatment of our patient with a pathoanatomical diagnosis of cervical radiculopathy and a pathomechanical diagnosis of a hypomobile C6-C7 segment driven by a lack of local muscle control of the deep neck flexors, we utilized the cervical flexion endurance test, aka 1-inch liftoff, as both an assessment and intervention tool. The primary goal was to reduce pain while enhancing muscular control and proprioceptive awareness by the end of the intervention. The study included 65 teachers from 25 to 45 years old who were divided into experimental and control group. The experimental group underwent muscle training using pressure biofeedback with exercise interventions, and the control group only underwent exercise. Pain, muscle endurance, and disability were measured at baseline and then 14 and 42 days after treatment. During the study, the authors also addressed the impacts of ergonomics in primary sitting jobs, which is important to mention as our current patient works in a pharmacy and fills prescriptions, which is also not ergonomically ideal. After 6 weeks, the experimental group improved by a mean of 2 and the control by 0.9. Both were statistically significant. After 6 weeks, the endurance scores were statistically significant in both groups, with the experimental group at 5.26 and the control group at 2.83. The same goes for disability, with the experimental group at 6.77 and the control group at 2.78. The researchers mentioned biofeedback is an activity that is associated with goal-oriented behavior, which could have been a factor of why the experimental group experienced greater benefits in terms of recovery. In managing our patient with cervical radiculopathy, we incorporated a manual cervical distraction, a traction-oriented manual therapy method highlighted in the 2021 systematic review by Kolowski et al. In our analysis of randomized controlled trials, traction-oriented techniques emerged as the most frequently used and were consistently effective in reducing pain and improving functional outcomes for cervical radiculopathy patients. Reflecting this evidence, we applied gentle intermittent distraction to increase intervertebral foramen space and alleviate nerve root compression. When combined with a rehab program, which includes deep neck flexor stabilization and scapular muscle strengthening, our patients experienced notable reductions in neck and arm pain, improved cervical range of motion, and enhanced functional capacity. These improvements align with the review's conclusion that traction-oriented manual therapy is both common and effective in radiculopathy management and emphasize the value of distraction as a therapeutic tool for decompression and neuromuscular re-education in clinical care. This case series by Waldrop describes the use of clinical prediction rule to diagnose cervical radiculopathy and the implementation of a multimodal intervention approach for treatment. 6 patients with unilateral arm pain were evaluated using a clinical prediction rule developed by Weiner et al., which includes 4 criteria: the Sperling test, distraction test, upper limb tension test, and restricted cervical rotation less than 60 degrees. Patients who test positive on at least 3 out of 4 criteria were included. The treatment approach combined intermittent cervical traction, thoracic thrust, joint manipulation, and targeted exercises including postural correction and deep neck flexor training. The Norwich Park Neck Questionnaire was used to track outcomes. The results showed all 6 patients showed clinical improvement, with Norwich Park Neck Questionnaire scores improving by 13 to 88%. 5 patients improved significantly to avoid surgery. At discharge, 4 patients no longer met any clinical prediction rule criteria, suggesting resolution of nerve root involvement. This study supports the use of the clinical prediction rule for diagnosing cervical radiculopathy and highlights the effectiveness of multimodal conservation treatment plans combining several interventions. These findings help guide our own diagnostic and treatment strategies for managing cervical radiculopathy in our own patient.